All right, hello and welcome. I am Dr. Peter Solomon, chiropractor, and I am going to just go over a few things about lumbar disc injuries. I've got some other videos out there explaining what they are and how to figure out if you have one. The treatment technique that I use that by far outperforms any other treatment I've ever used in my 25 years of practice is using traction, which is a form of non-surgical disc decompression. I specifically use the Kennedy decompression technique, and I found that to be successful. Yeah, my stats, I would like to say they're not quite 85% success rate, but probably between 80 and 85%. So let's settle on 83% success rate, where patients can avoid surgeries and can avoid other complicating factors with their disc injuries. So I've just made this little video of me setting a patient up on traction so you can see what it looks like if you feel like you are a traction patient and you want to know what you're getting in for. I've just put together this little video of a patient of mine today that I was treating. Yeah, so take a look. If you have any other questions, let me know in the comments, and I can try to answer those for you. All right? Chat to you soon. So in this video, I am treating a patient of mine, Debbie, who suffered a disc herniation and referred pain into the leg. And so I've been treating her for a while with traction, and her symptoms have pretty much resolved 100%. And now she comes in once a month for some maintenance traction, and just to make sure that the disc doesn't get back into a compressed state. The protocol I use for her is 32 kilograms, prone position, Vax long pull pattern, which is a 45-second pull, 30-second rest, resting at 12 kgs. So the pull stop is what really makes the difference with this traction. So it's not a static pull at one weight. It's the on-off motion that makes this as effective as it is. So you can see that Debbie is in a prone position. However, all patients don't need to be in a prone position. If you are more amenable to a flexed position, so if you have a flexion bias as opposed to an extension bias, then I would set you up in a seated position and just change the configuration of the table. Right, so that should give you just a little bit of an idea of what the traction session is going to look like. Typically before traction, if I am going to manipulate, I will do it before the traction, or if I'm going to use any needling or any electrostim or any other physiotherapy type modalities, I would do it before the traction, but the video is basically just so you can see what traction is. Treatment plans for traction can vary. Look, depending on how severe they are. If I'm dealing with a case, patient that cannot have surgery for some other reason, but they are a surgical candidate, but because of risk concerns, surgeons are hesitant, to do traction, then I would set them up on traction 3 times a week, maybe 4 times a week for a couple of weeks, and then downgrade that to maybe once or twice a week for a few more weeks. Start active care. So, even if you're going to have surgery for your disc injury, you're going to have to do some rehab. So the rehab is massively important to the success rate of your surgery, and even non-surgical options doing your rehab is going to be a big part of your recovery. So I would highly suggest that we then go into an active care state, probably after the first week, maybe 10 days of treatment, where you start training your core, your glutes, your movement mechanics, your squat mechanics, your hip hinge, all those sorts of things to get you moving better. Because ultimately you have a disc injury either because you just picked something up that was super heavy and you blew your disc, and that's a once-off, or it's come at the it's come due to faulty mechanics over a period of time. So and that is most people. So you got to clean those mechanics up and get moving better if you're going to stay pain-free and disc injury-free. So anyway, I hope this video helps. If you have any comments or questions, please pop them down below. You can give me a like and a subscribe. I appreciate that, and I will see you again soon. Cool.